Good day, dear viewers. Imagine you're enjoying a quiet family meal when your doctor gently suggests starting Atorvastatin to help manage your cholesterol levels. What if I told you this tiny pill, often known by its brand name Lipitor, has likely saved millions of lives and generated more sales than the economy of many countries? If you or a loved one has recently been prescribed this medication and you're seeking clear, reliable information on its effects, side effects, interactions, and more, you've come to the right place. Today, we'll explore everything you need to know about Atorvastatin in a calm and straightforward manner. This medication has been helping people maintain heart health since its approval in 1996. Let's proceed together, step by step, so you feel informed and at ease. To begin, Atorvastatin is a type of medication known as a statin, discovered through persistent research starting from a humble fungus in the 1970s and refined by chemist Bruce Roth in 1985. It works by assisting your liver in reducing the production of cholesterol, specifically by inhibiting an enzyme called HMG-CoA reductase, much like installing a traffic light on a busy highway to control flow. It is commonly prescribed to lower high cholesterol levels and to help prevent heart attacks, strokes, or chest pain in individuals with certain risk factors such as diabetes or high blood pressure. In simple terms, it helps keep your arteries clear and your blood flowing smoothly. The primary advantages of Atorvastatin are quite reassuring. It can reduce bad cholesterol, or LDL, by a significant amount, often between 36 and 53% depending on the dose, with higher doses up to 80 milligrams potentially lowering it by as much as 61%. Research indicates it lowers the risk of heart disease in those with high blood pressure and helps prevent serious vascular events in people with diabetes. Clinical trials show that for every 1,000 people taking it for 5 years, it prevents about 20 heart attacks and 10 strokes. For those with inherited high cholesterol, known as familial hypercholesterolemia, it provides effective long-term management. It also aids in secondary prevention for those who have already had a heart event, reducing the chance of another by up to 36%. Additionally, it may help with certain types of chest pain called angina, and has shown promise in off-label uses like reducing inflammation in rheumatoid arthritis or protecting kidneys during medical procedures. Think of it as a steady guardian for your cardiovascular system, promoting smoother, healthier days ahead. Now, let's discuss potential side effects with care. Common ones may include headaches, nasal congestion, digestive discomfort, sore throat, joint pain, or mild muscle aches, which are usually temporary. More serious, though rare, concerns involve muscle issues like weakness or breakdown, which might present as unusual fatigue or dark-colored urine. Liver changes are uncommon but could show as yellowing of the skin or eyes. It may slightly affect blood sugar levels, so monitoring is wise for those with diabetes, as it can carry a small increased risk of new-onset diabetes in predisposed individuals. It could interact with existing kidney conditions or be more noticeable in older adults. Regarding interactions, it's important to avoid grapefruit juice in large amounts, over 1.2 liters daily, as it can increase the medication's effects and raise risks. Limit alcohol to protect your liver. Certain other medications, such as strong antibiotics like clarithromycin, antifungals like itraconazole, immune suppressants like cyclosporine, or other cholesterol drugs like gemfibrozil, may interact adversely and are often contraindicated, so always inform your doctor. Supplements like niacin should be used cautiously under supervision. As for lifestyle, maintaining a healthy routine enhances its benefits. From patient reports, many appreciate the cholesterol reduction, though some mention muscle discomfort or tiredness. Those who should avoid it include individuals with active liver disease, unexplained elevated liver enzymes, allergies to the medication, or women who are pregnant or breastfeeding, as it may cause fetal harm or disrupt infant lipid metabolism. Guidelines recommend discontinuing upon recognizing pregnancy, despite an FDA update in 2021 removing the absolute contraindication. For safe use, dosages typically start at 10 to 20 milligrams daily, often 20 milligrams for many adults, increasing if needed up to 80 milligrams, and it's suitable for children aged 10 and older at lower doses. Unlike some statins, it can be taken any time of day, morning or night, with or without food, but always at the same time to build a routine. Swallow the tablet whole with water. Regular checkups for liver enzymes, muscle function, and cholesterol levels are recommended, usually every 3 to 6 months at first, then once or twice yearly once stable. You'll often see cholesterol levels start dropping within 2 to 4 weeks, with full effects around 4 to 6 weeks. Combine it with a balanced diet rich in fruits, vegetables, and whole grains, along with gentle exercise like daily walks. If any discomfort arises, consult your doctor promptly. They may adjust the dose. Alternatives, if suitable, could include other statins like Atorvastatin or non-statin options such as ezetimibe. As a generic since 2011, it's affordable, often costing just $10 to $20 per month. Let's address some common concerns thoughtfully. One myth is that statins suddenly cause diabetes. In truth, they may slightly increase risk in those already predisposed, but the heart benefits often outweigh this. Regular monitoring helps. Another is widespread memory loss. This is rare and typically reversible, often unrelated to the medication, with large studies showing no significant cognitive impairment. The idea that statins don't prevent disease is unfounded, as studies show they stabilize artery plaques effectively. Myth: you can control cholesterol with diet alone. While diet matters, about 80% is produced by your liver, so some need medication for genetic reasons. Finally, there's ongoing debate about overprescription for primary prevention. New risk calculators suggest fewer low-risk people may need it, emphasizing personalized decisions with your doctor. In summary, Atorvastatin effectively lowers cholesterol and supports heart health, while being mindful of side effects and interactions ensures safety. Always pair it with healthy habits for the best results, remembering it's not a one-size-fits-all solution, but a triumph of science that works best in a comprehensive approach. This is general guidance. Please discuss with your healthcare provider for advice tailored to you. If you'd like more such information, consider subscribing. Take care, and here's to your good health. Please don't forget that this content is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your healthcare provider before starting, stopping, or changing any medication. Thank you for watching, and see you next time.